Welcome to Health Equity in Action, Libraries, Communities, and Opportunities, a summit hosted by the American Library Association's Social Responsibilities Roundtable, also known as SRRT. SRRT believes that libraries and librarians must center social responsibility by recognizing and helping to solve social problems and inequities to work for the common good. My name is Julianne Winkelstein. I'll be moderating this session. I'm the co-coordinator for the SRRT's Hunger, Homelessness, and Poverty Task Force and a member of the SRRT Programming Committee. I am joined by Rachel Rosekind, who will be monitoring the chat, and Olivia Blake, who will be our tech person. To enable captions, click More in the bottom right of the screen, then click Show Captions. Our session today will be recorded, and the recording will be available on our website within a few weeks, along with any links or resources that were posted in the chat. This session right now focuses on community-based initiatives to bridge healthy equity gaps. We are joined by, yes, I'm trying to make sure what to introduce is really here. Matthew, and Matt Hulse.
Hulse. Good one. Yep.
Thank you. Executive Director, Contra Costa, Senior Legal Services, and he's going to be talking about medical legal partnership as a path to health equity. And Sunny Chung, Health Sciences Librarian, MLIS, AHIP, Stony Brook University, and Becca Nolder, MSW, MPH, Program Coordinator, Healthy Libraries Program, Stony Brook University. And they'll be talking about Stony Brook Medicine Healthy Libraries Program, or HELP. Okay, great. All right. We just gained 2 more people. We also will be joined by Reverend Diann Holt, founder and executive director of Durham's Maternal Stress-Free Zone. And she'll be talking about Durham, yes, that's what she'll be talking about. Sorry, the same thing that she's executive director of. Did I miss anybody on this? Okay, wait. Ophelia, yeah. Where do you fit in there? Okay. And Ophelia Morey, MLS, Associate Librarian, Health Sciences and Abbott Library, University of Buffalo. And then finally, Chloe Kilcrease, LMSW, Community Resources Specialist at the Central Arkansas Library System. A lot of information. The full bios for these people are available on our website. And we're going to be taking questions for the panelists at the end. So use the Q&A function at the bottom to pose your questions. And you can do that anytime during the presentations. And please reserve the chat to relay any tech issues, resource shares, which we've been seeing a lot of today, and appreciation for our panelists, which have also been seeing a lot of. All right, so we'll start with our first speakers.
Thank you, Julianne. That was a great introduction. I was chosen by some mysterious process to go first. The good thing is that it'll just keep getting better as you listen. So I'll start with a low bar, and then everyone else will get to come after me. So my name is Matthew, or Matt Hulse. I am the executive director at Contra Costa Senior Legal Services. As our name so aptly describes, we provide free legal help to seniors. I am not a lawyer, and so there may be limits to what I can try to convey knowledge-wise, but I'll do my best to talk to you today about medical legal partnerships, what they are, what they do, and how they impact equity. And because we are in a library setting, I want to try to also create some bridge there between library work and medical legal partnerships. I think that the bridge is here. I think for both the medical profession and the legal profession, these are humans who have invested a lot of time and effort in obtaining some very specialized knowledge. And then we pay them, or our insurance company pays them, or somebody pays them, for them to access that very specialized knowledge. And libraries, of course, are about knowledge. And so the underlying story that I want to kind of lay out here at the beginning so that you can kind of keep looking for it as I talk is that knowledge can be powerful, and access to the right knowledge at the right time can be very, very key. And so I would like to propose that libraries, even though they're not usually the hub of a medical legal partnership, could certainly fulfill a lot of the functions of a medical legal partnership by virtue of being kind of a hub of knowledge. So the main concept here with medical legal partnerships is the idea that symptoms and cause are not always the same thing. If I asked you to raise your hands, if I asked you to identify, is the following thing a cause or a symptom? I could say something like, is a headache a cause, or is an underlying cause, or is it a symptom? Hopefully, you all know that a headache is a symptom of something else going on. What is it a symptom of? Well, it could be a symptom of dehydration. It could be a symptom of tension. It could be a symptom of something serious. But it could be a symptom of a whole bunch of underlying causes. A recent study has determined that up to 80% of health outcomes derive from what is called a social determinant of health, something that is non-medical. It's not a virus or a disease of some kind. It's not something in your body that's breaking down. Those might play a role, but the underlying cause is something in our social network, our social fabric, that is causing a problem for the individual. And then these individuals show up in a medical setting, experiencing the symptom, but the doctors may not always be able to find those causes. For example, a child may be experiencing asthma, and asthma has certain, I don't even know what they are, but has certain features that a doctor knows how to look for and how to test. Does the person actually have asthma or not? You can determine, yes, they have asthma, but what's it coming from? So it could be coming from mold in the person's home. It could be coming from other kinds of pests in the home, or materials being used in the workmanship of the home, or just around the home, that are all providing these environmental problems for the child, and the child starts manifesting asthma. But it's not that the kid by themselves has like a predetermined, it's not a foregone conclusion that they're going to have asthma. It's not like in their genes or in their stars or something that they're born to have asthma. There's just things happening. And where the legal part of medical legal partnerships come in is that lawyers are uniquely placed to address some of these atmospheric problems. If there's mold in the home, a lawyer can go to a landlord and say, you should be following the law. Essentially, you should be keeping your house, the house that these people are spending money to live in, you should be keeping your house in a habitable state. And that can be true for a lot of things. There could be insufficient heat or insufficient cooling or all sorts of other problems where the housing is the cause of this medical problem, and lawyers can be part of the solution to the housing problem. So a medical legal partnership, by definition, is a situation, a system where lawyers have embedded themselves in the medical system. Either physically, they might be in the hospital or in the clinic, or sort of virtually by having trained the nurses, the social workers, other people in that medical system to detect issues that can't be solved with medicine or surgery, but might be solved through legal action. And when those issues are detected in a medical legal partnership setting, lawyers can spring into action address the underlying issues that are manifesting as a health problem and get much better health outcomes. There was a study, speaking specifically of asthma, there was a study that came out that found that, I have a piece of paper here with stats, that where children were utilizing an MLP, they had 62% fewer days with uncontrolled asthma as compared to folks that were just coming in for medical treatment. So medical treatment can do a lot of things. I don't know all the things you could do for asthma, but you can give them inhalers and probably other things. But the medical treatment alone was not sufficient. But where you paired the medical treatment with a legal action to resolve these other issues, they had 62% fewer uncontrolled asthma. Medical legal partnerships currently exist in about 450 hospitals and health systems across the country. So this is a model that is being widely used and helping folks. Looking for some more statistics that here that might be useful. The basic concept, I guess I also want to put across about a medical legal partnership is that medical problems themselves are a type of symptom. They're a type of social symptom of underlying social problems. Black people, as an example, are twice as likely to face eviction than any other racial group. And oh, sorry, twice as likely than white Americans. Sorry, not that anybody else. And eviction can be a super stressful and problematic issue. You can lose access to your medication. You can stop making medical appointments. You can experience greater stress and all the problems that happen in your body because of stress. So social problem exists where eviction is happening at higher rates in certain communities and in certain neighborhoods. But that's sort of the underlying cause socially that's manifesting in more health problems in those same populations. I did before the comparison of cause to symptom purely within a health context. So you could have a underlying health problem that's manifesting in a health symptom, which is a headache. But you could also have social causes across our society, across all our communities, that then manifest as health problems in the humans that are living in those communities. And I guess I would like to portray the law as one instrument for dealing with social inequities. Maybe the law is failing. I would probably say that it is, but laws at their best are designed to say things like certain behaviors, certain conditions are illegal. They just shouldn't happen. Landlords should follow certain rules. Factories should follow certain rules about how many emissions they're allowed to belch out into the community. And yet those laws aren't always followed. And lawyers are a way to make sure that laws, as well-intentioned as they might be, actually have some impact in the communities. And so if you can't access a lawyer sometimes, you are also not accessing the law, and you are not accessing one way to bring greater equity into our communities and for all of our people. A medical legal partnership, I'm going to try to stop early. I don't know if anyone's giving me time signals, but I'm going to try to stop a little bit early so I don't know if we're going to address questions, but I want to make sure I'm focusing my comments on things that are the most interesting to people that are listening. But medical legal partnerships address the individual situation that's in front of you, the person who has mold or other problems in their house. But through a medical legal partnership, you can also uncover systemic issues. You can just uncover the fact that a landlord is across the board, mistreating all of their tenants. You can uncover that a whole neighborhood is experiencing health problems because of some either present or past thing that happened there. I mean, like, there's environmental cleanup situations that don't always get uncovered right at first until enough people are presenting with an issue that then is uncovered, and laws are passed, or existing laws are enforced, and that problem that can be an issue for a whole community can be addressed. I talked earlier, I'm thumbing through all my facts and figures here. I talked about the legal or the medical problems that can result out of an eviction. Where there is legal representation in an eviction case, eviction rates drop by 77%. So eviction isn't fun for anybody. Eviction happens more often with poorer and with BIPOC communities, and access to a lawyer can be very, very difficult for these same communities. But legal aid, such as I represent, provides legal help for free and can greatly reduce the problems of eviction. When a doctor says your landlord's failure to fix your heat is making you sick, and we're going to fight that with you, it changes the therapeutic relationship and affirms the patient's dignity. So when a patient doesn't feel like, oh, my sickness is just me, and like there's something wrong with me that's causing me to get sick all the time, but you're able to portray that patient in the context of things that are out of their control, at least temporarily, and causing them these problems by giving them the legal insight into there's a wrong being done, it's not your fault, and we can stop that wrong. This can change that person's sense of themselves, of the debt that society owes them, and of their own initiative and ability to make changes in their lives. I guess the other point that's here in my notes that I want to draw out is this cost benefit idea. One of the most expensive things in our medical system and for society generally is people that end up in the emergency room. Emergency room visits can be cut dramatically when you address the social determinants of health that are taking patients into the emergency room over and over again. And so when a medical legal partnership can be set up, or when just knowledge is provided, I guess I need to be saying this as often as I can, because libraries as hubs of knowledge, and the libraries of my county are some of our best partners here as a legal aid organization. When libraries can help patrons find knowledge about social determinants of health, about the availability and efficacy of a legal solution to a problem, they empower that individual client, individual patron, to take things into their own hands and to make a lot of changes that can have huge health impacts for them. I think I've covered most of the facts and figures that I wanted to. In terms of equity, folks that have one medical problem or one legal problem very, very often have multiple problems that can compound and stack and interact with each other in devastating ways. It can often not be sufficient to simply pick a single problem and try to fix that, because they're all interconnected. Folks that have a lot of resources can address each of these problems with multiple professionals in their lives, but people without a lot of resources or with other barriers, like language barriers, they're not going to be able to tackle all of these varieties of issues that are interrelated and all causing problems in the person's life. But libraries can empower with knowledge, and where there are functional and effective partnerships between a medical professional and a legal professional, that can be a powerful combination with those specialized knowledge that a medical professional or a lawyer brings to resolve a lot of problems in a person's life and improve equity for those people that otherwise don't have access to a lot of services. I think that's my big plea, is that when you get people to work together, especially knowledgeable people, their power improves and impacts people in much improved ways. I don't know who's keeping track of my time. I don't know if I took as much time as I was supposed to, or too little, or too much.
Um, I was supposed to, and I forgot to look when you started because I got so thrown off by all these people, not people, whatever. Um, so does anybody else know what time it is? I don't think you've taken the full.
Think we're on time. I think we're
We're
on
on
time.
time. All right.
Okay.
Okay.
Well, I'll reserve some time of my original allotment for the end so I can answer questions.
Okay, great. Thank you. And I'm going to start writing down when people start now. And thank you very much for that. That was really interesting. Um, yes, somebody's just posted a comment about that, social determinants of health and the importance of that is. All right, our next speakers are Sunny Chung and Becca Nolder, and I will turn it over to you and look at what time you started.
Thank you, Julie. Hi, everyone. So we're here to share about the Stony Brook Medicine Healthy Libraries program, otherwise known as HELP. And thank you so much to CERT for having us. So before we get started, let's introduce ourselves. I'm going to pass it off to Becca.
Hi, everybody. My name is Becca. I am the Healthy Libraries Program Coordinator. I have background in social work and public health with my MSW and PH, and I'm really excited to be here today to chat with you all about healthy libraries with Sunny. And thank you for having us.
I'm Sunny Chung. I'm a health sciences librarian at Stony Brook University and a faculty member for the Healthy Libraries program. So just to get an idea of where we are, Stony Brook University is on the North Shore of Long Island, New York, so right where this gold star is. Our objectives for this presentation today are to introduce you to the HELP program and discuss the role of public libraries in community health and outreach. We'll go over how the program model addresses the social and behavioral determinants of health, partnership with public libraries, and discuss the impact of the program. We'll also be examining how the program will be replicated in other communities, and we also encourage you to follow up with us to continue to learn about programs and services and monitor the ongoing impact of our program. So the Stony Brook Medicine Healthy Libraries program is known as HELP, and this was launched during the 2020 to 2021 period as a collaborative community initiative. This program represents a unique partnership between the Suffolk Cooperative Library System, which serves libraries across Suffolk County, and healthcare professionals affiliated with the health sciences schools and programs, including faculty and staff. HELP also brings in undergraduate and graduate students from across the health sciences who are completing fieldwork, practicums, internships, or service learning experiences. Together, these students work to connect communities with reliable health information and resources through local libraries, helping to improve public health access and education at the community level. And these are the student professions engaged in the program. The origins of the program can be traced back to 2016 when the Program in Public Health Executive Director, Dr. Ben Scott, first learned about health programs in partnership with public libraries. This insight came through her involvement with the Long Island Health Collaborative. A few years later, in 2019, Dr. Ben Scott conducted interviews with Stony Brook social work students who had been serving as interns in public libraries. Through these conversations, she identified an important gap. While libraries were addressing social needs, there was a growing demand for applied health and clinical expertise within these community spaces. And to meet these needs, the Healthy Libraries program adopted an innovative group supervision model. This approach brought together students from clinical, public health, and social work disciplines, allowing multiple professions to collaborate in communities more effectively. It also made it possible to expand the program to additional library sites. The growth has been significant. So in 2020, the program operated in just 5 library locations, and today has expanded to more than 15 library sites with dedicated student teams and offers additional programming and services across 50 library locations. This evolution highlights how interdisciplinary collaboration can transform libraries into hubs for community health support. So here's an example of our Healthy Libraries team throughout the years, and many students training in a variety of health science professions have been involved in this program, and we're excited to continue to onboard and interact with new students each semester.
And I do want to add, actually, in that slide before, Sunny was one of our very first Master in Library Information Science interns. So she started as an intern and then started working for the university and is now part of the HELP faculty and provides supervision to our Masters in Library Information Science students. So I just wanted to give a shout out to Sunny there.
Thanks, Becca. Okay, so, and here's an example of our Healthy Libraries team taking a patron's blood pressure at one of the local libraries, and on the right side is one of the interdisciplinary teams. So at the core of the Healthy Libraries program is strong collaboration among health sciences faculty. We train and supervise students to work on interprofessional teams placed in public libraries throughout Suffolk County. In these library settings, students from different disciplines sit side by side, working together to provide community members with free access to evidence-based programs and helping connect them to the care that they need. These teams focused on addressing key social and behavioral determinants of health, and they do this through a variety of services, including health education, screenings, resource navigation, case management, direct connections to care programs, and support services. And beyond student teams, faculty and staff and engaged students across health sciences contribute to a wide range of services within the public libraries. These include health presentations, connections to health experts, and valuable internship opportunities in social work and health education. Together, these efforts help transform libraries into trusted spaces for accessible, community-centered health support. So the first goal of the program is to provide evidence-based programs that address the social and behavioral determinants of health. This work is carried out in close partnership with public libraries across Suffolk County, helping to bring reliable health information directly into the community spaces. And another important goal is to connect public libraries and their patrons with community resources that support both health and social needs. By bridging these gaps, the program helps individuals access the care and services that they might otherwise struggle to find. The program also focuses on education and workforce development. It trains students and provides them with meaningful opportunities to practice within their own professional scope, while also learning from other disciplines through team-based program delivery. As a result, students not only gain hands-on experience, but also develop and apply interprofessional skills and competencies, preparing them to work collaboratively and in real-world healthcare and community settings. So examples of patron interactions include a clinical student, such as someone studying nursing or physician assistant studies or medicine, begins by screening a library patron for high blood pressure. And then a public health student or library science student steps in to share clear evidence-based information about managing and controlling hypertension, along with helpful resources that a patron can use. It could be a bookmark with a QR code, for example. And then a social work student may discover that the patron hasn't been connected to care, and they help bridge that gap by connecting the individual to healthcare providers and relevant community resources. So together, this team-based approach ensures that the patron receives not just a screening, but education, support, and a pathway to ongoing care. So why libraries, and why we think that they're part of the public health workforce? So libraries are typically open between 5 to 7 days a week. They're air conditioned and heated, have a bathroom and water fountains for all that are available to them, friendly and compassionate staff. They're typically in close proximity to public transit, and there's free internet access and programs for enrichment such as life skills, health, and healthcare. All right, I'm going to pass it off to Becca.
Great. Thank you so much, Sunny, for that wonderful overview of our program. So as I said earlier, I'm the program coordinator of Healthy Libraries program. And what really interested us in wanting to talk with you all today about our program is the direct theme of addressing social determinants of health, since that's like the biggest goal of our program is to address social determinants of health. And here we have a more of a conceptual map of what social determinants of health are. In our public health courses, this is something that we teach to our students, and we use this exact framework from the Beyond Healthcare article that I have listed above. So when we're looking at social determinants of health, as Matthew so eloquently said during his talk previously, social determinants of health are all these conditions in which people are born, grow, live, work, and age that impact their health outcomes. So this is looking at more of a holistic model that examines how health outcomes are driven by all these array of factors. So on our chart here, we're looking at economic stability and how that it can impact our health outcomes through things like employment, income, expenses, debt, etc. Neighborhood and physical environment. So do you have reliable housing? Are there parks, playgrounds? What's the walkability of that area? Same with education. This impacts our literacy, language, training, and ability to pursue higher education, perhaps. With food, this is looking at access to hunger, food insecurity, and how this impacts our access to healthy options. Then looking at through community and social contexts, we're looking at social integration, support systems, what is the community engagement involved, and then directly looking at the healthcare system, we're looking at the quality of care and providers that folks in communities have accessible to them. And this is holistically looking at social determinants of health. And I'm sure that everybody on this talk has a general idea or framework already of what social determinants of health are. But we always like to include this because this is a direct goal of our program, because we believe, and the research shows, that public libraries are an effective space to address social determinants of health. And that was the whole origin of the program. When Dr. Ben Scott read the Beyond books, why public libraries are partners for population health, this is really what sparked in her mind of, oh, we can go to the community through these spaces that are already accessible and have this level of trust to address social determinants of health directly by placing trained professionals and student teams within these spaces to address these different array of factors. So Sunny, could you please go to the next slide? So when looking at how libraries address social and behavioral determinants of health, this is also taken from the Beyond Books article that I just mentioned. That was the spark, the idea behind our program, and from the Beyond Healthcare, which was the framework that I showed you before. But we're looking at different programs and factors that this is how libraries, and there's a whole array of other things we could probably add to this list. This is not exhaustive, but there are so many ways in which libraries address social and behavioral determinants of health. For example, through education, early literacy programs that they offer, summer reading programs, digital resources and technology assistance, as well as through food, supplemental food nutrition programs, food preparation courses, culinary literacy center and programs. Something else that should be on here is food pantries, which ties into maybe those supplemental food nutrition programs. Within the healthcare system, too, you'll see at the bottom of this list health clinics and health experts co-located at public libraries. And that's kind of where our program comes in. Public libraries can serve as this space for healthcare services and delivery, not necessarily being delivered by public librarians or through librarianship, but rather through trained professionals coming into this space. So as I said, this list isn't exhaustive, but in our mind, it's really helpful to conceptualize how libraries address these different array of factors through their different programs, and through that level of trust and accessibility in the community. So thank you. All right, next slide. So in our program specifically, we do have our students sit side by side in public libraries. We're in about 15 public libraries every semester with our student teams, but we offer other programs and services to about 50 public library locations in Suffolk County, Long Island. So all of our students on our team are trained to document each of their interactions with public library patrons in real time using a web-based password protected Qualtrics data management tool, which is just like a fancy way of saying survey. But the topics that are documented are any information given to a patron related to health and social needs. So if a patron is interested in being connected to a primary care provider, or if they're interested in cancer screening information, we're logging that and tracking these different health topics that are coming up in patron interactions. Any educational resources or services provided to the patron, we're also documenting that. Their blood pressure. So as Sunny mentioned earlier, we have a clinical student sitting at the team who can offer a free blood pressure screening to the patron, and we're recording if that's been taken place. And if there are, if the patron qualifies as having a high blood pressure, according to the American Heart Association blood pressure guidelines, if they are in a hypertensive high blood pressure reading, then that is also being documented as well. And we're tracking if there are also other factors going on within that individual's or patron interaction, such as if they have been out of care for a long time, or if they requested being connected to somebody in care. So we're tracking that along with that. Any patron responses to blood pressure care and control and management. The only sociodemographic information we collect, age, gender, zip code, but we're not collecting identifiable information. Everything is de-identified. We're not asking for names. We're not asking for like very intense information. It's more to gather a accurate depiction of the health and social needs of the patrons that our students are interacting with, and so that we can best address those needs. We're always keeping track of those different outcomes. Additionally, we do ask any 3 questions from the CDC, hunger, vital signs related to food insecurity, and then if any referrals are occurring within that patron interaction. So if a student is interacting with another student, meaning that they're collaborating together, say the clinical student takes the blood pressure of a patron and their blood pressure is high, then they can refer to the public health student at the table, who can then jump in with different resources related to hypertensive care and control. So we have different resources at the table related to that through the AHA, and then they can jump in and offer the patron those resources. And additionally, they could connect them to a self-monitoring blood pressure kit, which is another service that we offer to public libraries through the county. We're not really going to touch on that this much in this presentation, but the self-monitoring blood pressure kit is available at 50 public libraries in the county. Patrons can rent out the kit for free for up to 28 days and track their blood pressure from home. Just like renting out a book or renting out a movie, it's completely free. They just need a working library card. But if we see that the patron has high blood pressure, and it could be possibly undiagnosed that they have high blood pressure, then we can offer this as a resource for them to track their blood pressure from home. But the students are working together, collaborating to address the different needs of patrons. And then we're also tracking if any outside referrals are also being made. So any referrals being made to care outside of the help team. Next slide, please. So our program, one of our big goals that we are working on is actually creating an implementation guide. So this is kind of the beginning thoughts of our implementation guide, but our program can be replicated and adapted with a different community context. So when we've started the Healthy Libraries program in circa 2020, 2021, we partnered with the Suffolk Cooperative Library System, which in turn then we were able to partner with different member libraries of that system. Additionally, we have partners with Stony Brook University Health Schools and the Stony Brook Hospital as well. Our students are able to be trained by the Cancer Center and Heart Institute and the Stroke Center through the hospital setting. And so they're also involved in our program. Additionally, we are trying to collaborate and expand to other disciplines within the health sciences schools of Stony Brook University. So that's something else we're thinking about. But this is really to start thinking about implementation and replication. That is a big goal of ours for the future because we've seen that our program has been successful and has achieved great student interprofessional competencies and learning for our students and their experience in the program, but also for our communities at large and connecting them to care. Next slide. So the goals for our future is to expand to additional public library location in and outside of Suffolk County. So I'm not sure if you all are aware of the geographical context here, but we have Suffolk County and then next door is Nassau County. We'd really like to expand our program first to the other neighboring county in New York, but then also, as I said before, to replicate it in other states and county contexts. Additionally, we would like to strengthen program ties to health and clinical providers to increase the number of patrons connected to care after receiving our program services. We would like to integrate additional health-related professions in the team model to expand the scope of services that we're delivering to patrons. And then presentations like today, we would like to continue to do. So continuing to share healthy libraries through dissemination activities, through semester and annual reviewed reports, peer-reviewed publications, national conferences, and university-wide presentations. I will share our website link in the chat. We do have a QR code, I think, in the next slide to our website. But on our website it lists all of our publications as well if you're interested in reading more about our program and our scholarly work. Additionally, a big goal of ours is to network with similar programs nationally so that we can continue to develop resource sharing, co-learning, and build capacity of our program to then address social determinants of health in partnership with public libraries. So thank you so much for having us today, and we're really excited to continue to learn about all the other programs going on and continue to collaborate with and learn more about your programs so that we can continue to improve ours. So thank you so much. And yeah, and here's our website, email, contact information if you want to continue to learn more.
Thank you. This is really amazing. And I love the way things are sort of weave together too. It's really, plus the presentations the last couple of days, the social determinants of health has come up so many times. It's really
Yes.
amazing.
Yes.
It really is just like, I love it. Yeah. All right, thank you. And our next speakers are Ophelia and Diann.
Thanks, Julie. Hello, everybody. I'm Ophelia Morey from the University at Buffalo, and I'm here with Reverend Diann Holt from Durham's Maternal Stress-Free Zone in Buffalo, New York. We're sharing space here today because I would like to interview Dr. Holt about her experience with Black maternal health and her program. Before we get started, I just want to give a definition of what Black maternal health is. Black maternal health focuses on the significantly higher rates of pregnancy-related deaths and complications among Black women who are 3 to 4 times more likely to die from childbirth than white women. It addresses systemic racial disparities, unequal access to quality care, and social determinants that make over 80% of these deaths preventable. So I'm just going to jump right in with Dr. Holt, Reverend Holt. Please, could you just explain? You could be getting an honorary doctorate from the University of Buffalo, I think, at this point. So can you please share a bit about your journal and how you entered into the space of like Black maternal health?
Good evening, and thank you for the invite, and thank you for trusting me to share information that has been a lifetime journey. For those who do not know, I will be next month 78 years old, and I've been doing this. When she said, "How did you get into it?" I believe I was birthed into it. I am basically Southern born, and I guess you can say urban raised. I was born in a little small town called Manchester, Georgia, and I was raised in New York State. So, as my parents would say, I'm a little bit country and a little bit rock and roll. And as I share with Ophelia all the time, I believe that laughter is a form of medicine. So you'll see me smile a lot, laugh a lot, because we got too many people who are falling apart because they don't have the joy of laughter in them. And if you can bring a smile on anyone, you've done half the job, because there's a lot of misery in this world, this day and age. Now, to answer your question, when you think about why I entered into and why I do what I do, is because I had an opportunity to personally, professionally witness all the social determinants of health. And I work with a large group of women who are caught within that network, and we're sort of like that safety net for them when they come to our program. And that's why we call it Durham's Maternal Stress-Free Zone, because when you walk through those doors, you leave that garbage that has beset you, that's tearing you down at the door. And we will have hopefully the resources that you're going to need to maneuver through that maze that you find yourself in. That's how I got into it.
So you're being like, of course, that's the short version of your story. But I know that you started the first baby cafe in New York State. So if you could just give a little bit of that backstory as to like how that came about, I think that might be helpful.
Well, the Surgeon General at that time was Regina Benjamin, if I'm not mistaken, and research was done on breastfeeding. There was a doctor, I won't say her name, there was a doctor who approached me and she said, I need you. And I said, what do you need me for? And she goes, well, breastfeeding is at one of the lowest rates in Erie County. We've got 67, I believe, there's counties in in New York State, Erie County, and Erie County ranks 54th. I said, really? And she goes, and when I approach individuals about breastfeeding, I hear all types of stories. And I said, okay, let me go see if I want to do this. Well, I went with her and I got the shock of my life. I heard things at the time that I grew up, breastfeeding was something that you just did. It wasn't something that you thought about. You breastfed your child. That's all there was to it. Nobody was going to offer any formula because we weren't going to use it. These young moms that she was taking me to, they had been indoctrinated by the pharmaceutical companies and the hospitals who were giving them the formula for free, not to use their own natural milk, but to use formula. And they wanted to know why breastfeeding was failing. Well, it was failing because they were getting freebies and something that breast milk was far superior over, and the reasons that they gave for breastfeeding just made absolutely no sense. Like the example I was given was my breasts are going to sag. Well, gravity's going to pull them down anyway. So you might as well go ahead and breastfeed. Uh, so that's how I came into that. That's how I opened the first baby cafe. Listening to a physician, a pediatrician at that time, tell me that she was having a difficult time with women who look like me, young women who look like me, with regard to breastfeeding.
Mhm. And how did that baby cafe evolve into the program that you have now? And can you just talk a little bit about your current program and
Yes.
what you offer to the community? Of course, it's all based on the social determinants of health,
Yes,
but
they are.
just
There was a monster called COVID that no one knew absolutely anything about. I know I didn't. I have a nursing background, but I had never heard of anything called COVID. But once I started reading my bleach bottles, I found out that COVID's been around for a long time, okay? If you pick up a bottle of Clorox, you'll see back at that time, COVID was one of the things that was listed that it killed. It worked against. So I'm sitting around saying, well, what is this COVID? Where did it come from? Nobody had an answer for me. So we had to shut down our baby cafe and we had to come up with an innovative way of reaching those individuals who needed us. So what we did was came up with, I told you, it was called the Love Porch Drops, which basically was we take a phone call from them, ask them what they need. We would go to the pantries, we would go to wherever it was that they told us, load up uh, maybe about 10 to 12 SUVs, and we would give them a call when we came to the house, mask, whole 9 yards, put the request on the front porch, give them a call and say, come out and pick up what it is that you need because it's on your porch already. The love drop has taken place. So dealing with COVID changed the whole trajectory of what it was that we were doing and how we were doing it and how we were responding to pregnant women and their needs. And you also have to keep in mind, too, the hospitals put doulas out at that time. We weren't allowed to go in. We had a lot of moms giving birth in uh, parking lots and in hospital elevators. And the message had gotten back, Governor at that time was Como. And we got an opportunity I sat on his task force along with Kathy Hochul's, Governor Hochul's task force, where we were examining the reason that women were not going into the hospitals. And we found out that the word that came across to those who sit high and look low was that they were afraid of what were they? Oh, afraid of COVID, and that wasn't the answer. They were afraid of birthing alone. They could not bring their husbands. They could not bring their trusted individuals who was with them, and they would rather wait to the last minute before going into the hospital to give birth to their baby. And if that meant giving baby in the toilet, and that's what we encountered on many occasions. And we had them, there were a few examples of where they videotaped it, and we sent it to the governor's office so they understood that we were actually being honest about what was taking place.
Mhm. So what makes your approach like different from other like programs that are like based in hospitals or other community organizations? Because your program is based, it's like I would consider it a faith-based program because it operates out of your church, even though I understand that you don't put, it's not a religious program, but it's a faith-based program. How
Yeah.
does that like differ, or why is it needed like in the community, like to support people?
When you hear the word trusted individuals within the community, may it be a church, a synagogue, a mosque, or a temple, or wherever it is that people worship, they usually trust people within those doors, or they wouldn't go.
Mhm.
So our program may be faith-based, but we understand that in order to live earthly, you've got to be able to reach and touch those things that are earthly touching the body. And if you don't approach it from that point of view, you're going to drop the ball each and every time. My parents used to say, I kept changing my professions because um, I didn't have sense enough to stick something out. I would tell somebody off and leave. Well, that's not really true. What happened was that every time a system would change and I would see that it was broken, I would say, you're not broken. You're working exactly the way you're designed to work. So I don't want to have anything to do with you. So it switched from nursing to social work, switched from social work to becoming into ministry. I am actually an ordained minister in an international church, global, really, if you want to know the truth, the African Methodist Episcopal Zion Church. I am legitimate, although I did retire this year from it because I need to focus on the physical piece, the physical body of mothers, and the physical needs of individuals who cross over our threshold.
Can you talk a little bit about that when you say like the physical needs? Like how do you engage with people who come to your program in regards to
Okay, how do
those
we
needs?
engage? Well, anyone that crosses over our threshold, even though I am African American and my DNA also says I'm Native, so I'm a combination of two, what they call minority groups, but I don't consider myself a minority. I consider myself a human, okay? So when they cross over the threshold, I greet them as a human being, first of all. I attempt to look at what's causing the greatest amount of pain for them. I can assume anything that I want to assume, but if I don't ask them, I don't know. So we usually say to them, what is it that you need that you believe we can supply you with? And then they tell us. Sometimes they tell us the truth, sometimes they don't. But why should they trust me? They're just now crossing over our threshold. So we allow them to get to know who we are, and we are consistent, and we basically attempt and tell them we're going to meet those needs the best way that we can because money's not pouring into me, into my program. So we meet those needs the best way we can according to how they say their needs should be addressed.
Mhm. So your program has been in operation like how long? 15 years, I think. How many?
We have been a
430.
legitimate 501c3 for
Mhm.
15 years,
Okay.
but my program has been around since 1997.
So can you give examples of like specific like services that you provide or like needs that the participants like that they come in and they request?
Mhm. In Erie County, we were the first organization to actually fundraise, pay for doulas before anybody else knew that a doula really existed because I was delivered by a granny midwife in the South. So I personally know what a doula is. We were the first county in New York State to take Lamaze. We flew to Washington to be the Lamaze birth coaches. We became certified lactation counselors. We work with the Lalichi League. Anything that works that will help the individuals, what we would do is fundraise, raise the money if it meant we had to send them all the way to Rochester to train. We paid for the transportation, we paid for the books, we paid for the training, we paid for everything to train people to meet the needs of the community. We were the first in the county to do that.
So specifically, I know that your program offers dinner, which
Oh,
is
yeah, we
very
feed them.
dinner. You provide, for example, you get a lot of donations. So people can sometimes get like household items or like baby clothing.
I'm going to correct that.
Mhm,
The volunteers, we're all about volunteer-based organ. We're a volunteer-based
mhm,
org. We have no paid staff. So if someone comes in and they're barefooted, somebody reaches in their pocket, run to the dollar store and purchase the shoes
mhm.
for their feet. If mom has slept outside in the rain, we will provide them. Give you an example, when they were placed in a shelter and the mom showed up, her and her baby was all bug bit. We didn't send her back to that shelter. What we did was we paid for a hotel room until we could get her down to social services to get her into a shelter that did not have bed bugs. It appears that a lot of money is coming in and a lot of donations, but I love
Well,
the
I know that
University
is
of
not
Buffalo.
allowed.
But I love the University of Buffalo.
I know
I'll be
a lot of
honest.
money is not good.
I love these guys because even the pharmaceutical students,
Mhm,
they did a fundraising for us and they brought in diapers and wipes and formula. So when people know that you're doing what you say you're doing, they help out. But that's hit here, there, hither, whatever.
mhm.
If it's not coming in, we have to meet that need. So if it means going into your purse to do it, we go into our purse to do it.
So just let's go back a little bit. You mentioned doulas, but I feel like you sort of skipped over that.
Okay.
So when the moms come in, I know that there are doulas there and they have
Mhm.
an opportunity to engage with the doulas
Mhm.
and they can actually like select a doula that they would like to work with.
Absolutely.
So can you talk a little bit about that like process and what happens and how do they like get the call like at 3 a.m. and they rush to the hospital? And they're doing this for free, of course, because they're volunteers.
Of course, New York State pays for doulas, but those that come into our program, they don't want the payment because it takes too long for reimbursement, for one thing. And it's more of a mission than it is an income-based thing. We do it for outcomes, not for income. And so when mom comes in, it's like when you go visit a doctor, you interview your doctor, I would hope. So when mom comes into our program, we provide them a free meal. And when I say a free meal, I mean we shop at the most expensive markets in the city. I feed them better than I feed my own children. Um, we try to teach them the appropriate way to eat because being pregnant, having to deal with the social determinants of health, and everything else that they have to deal with, we want them to understand that they need to eat appropriately in order to make sure that the nourishment for themselves to be able to carry that baby for the duration of that pregnancy and to make sure that they birth into the earth a healthy baby. We teach them all the basic needs. And I don't like the word teach. And the reason I don't is because we're not an educational component. And I want somebody to say she's teaching. What we do is we give lessons, okay, and information on that. And we bring in other individuals who are experts, dietitians, physicians. Let's see, who else? I don't use politicians. Um, let's see. Oh, the smoke-free menthol people that come in to teach about smoking, cessation. We use all the universities that we have here. They know me on first name basis. We use all the hospitals. When I walk in, they know exactly who I am because I'm looking like this as I walk through. The bottom line is that you have to make yourself known and show yourself friendly if indeed you want to receive the respect that you want someone to give you.
So So I'm sorry to keep going back to
No,
the
go ahead.
doulas,
Oh.
but why do you think doulas are important, like in this Black maternal health space? Like, why is it important to have access to doulas?
Doulas are very important. And the reason doulas are important is because a doula is not a medical professional. A doula is, the word basically means woman servant, okay? And when you look at countries that they want to call third world, I don't call them third world, but when you look at countries that are not as industrialized as the United States of America, you'll know that that doula becomes that social worker, that nurse, that doctor. This country limits that doula's role. Other countries do not limit the doula's role. So we become that voice who teaches mom the things that she wants and listens to what it is mom says that she needs in order to birth her child into the world in the manner in which she wants to birth her child into the world.
So where do you think like people or your participants of your program get stuck when they're trying to like access information or care?
They get stuck because the majority of them really have no idea what's really available for them. I always share with you, when you first came to our program, Ophelia is like a heartbeat for me. When she first came into our program, she had sense enough to come in and not try to take over, or we would have walked her out of the door. Um, she came in with an attitude of gratitude, and she actually came in with a program called LACMED, if I'm not mistaken. Was that?
I did a training session
Yeah.
on different information resources, and LACMED was one of them.
And we have a lot of moms who have high blood pressure, diabetes, all those things that will beset you in pregnancy. Not all of our mamas have that, but there are more than enough that have those things going on in their life. So because they have this thing where they don't always necessarily trust the doctor or whoever their healthcare provider is, we want to be supportive of that individual by saying, okay, what did your doctor put you on? And if you're afraid that this medication is going to have a negative impact on your baby, let us know what it is. And we've got Ophelia over here who's given us a tool so that you can look it up for yourself. And then you tell us how you feel about it. Make the notes for yourself. And then when you go in to see your healthcare provider, talk to that individual about the reason they have you on that medication. 9 times out of 10, the medication that the doctor or the physician has placed them on is something that is not going to have an impact on their fetus or their baby when they're breastfeeding and nursing. But they need to learn that for themselves. I can't just tell them that.
So I know that your program is very popular for like academics, researchers, from like, as you mentioned that you know people from all the universities and colleges. Can you talk a little bit about that, like forming those partnerships and definitely the ups and downs, you know, it's good, but there are some challenges sometimes.
Primarily, they're mainly
Yep,
up
exactly.
because they know who I am. They're not coming in if they're coming in. And I don't believe that they're going to be of service of the people that are there. However, the downside is sometimes the research piece, you know. Matter of fact, we were at a research project, what was it, last week?
Conference, yes, research day at the University at Buffalo.
And I listened to some information that was basically being said. If you don't break it down and explain it in a way where people understand, you'll get a mixed message. Example where they say, you even said it today, 3 times greater rate. Well, that's nationally.
3 to 4.
3 to 4 times greater
that
rate.
is national.
If you look at Erie County, it's 5 times. If you look at New York City, I'm told it's 12 times. I'm not sure. I haven't done the research on that. That if you're a woman of color or African American, you run the risk of not surviving that pregnancy. And as you know, we're burying on Saturday a young lady who did not basically make it through the pregnancy, and she died 3 hours after she was told that she was going to make it. So, but she went in without a doula too. It's just to the point where it's so real when you see it so often and you can place a face and a name and a family to it, it becomes personal.
So like going back to like academics, what do you think that we should like start or stop doing when engaging with the community?
Okay. First of all, I need to put on listening ears. And the research, and as you've learned too, that they're not going to listen to me no more than they're going to listen to you. Maybe a little more trust of me than it is of you. However, they have a mindset of their own, and you have to ask that question. What is it that you need? Not what I believe you need. What do you need? What will help you? So if academics can basically understand that, yeah, your research brings out a lot of information, but we are not a transaction. We are not a statistic. We're not data. We're human beings. And if you can understand that when you start talking in terms where it comes across that they sort of see themselves as data, they're going to back away from you.
Yeah, I know when I started visiting the program, I was joking with you about this. I did a lot of like washing dishes and moving chairs and tables before I, stopped in, but a lot of listening. I sat at the table and I listened to the moms, that was there, so
I
I
always
think
tell
that's,
everybody the dishes, it's a litmus test. It's just want to make sure that you're going to pass it, okay? If you can't do the dishes, you can't sit with the moms. But no,
okay.
on the serious side, yes,
Mhm.
listening is very important.
Yeah. So from your perspective, what does an authentic partnership, what does that look like for you?
What
As
does
far
that
as
look
from an
like?
academic perspective, when you're,
Academic perspective. Okay. I always tell everybody it's like a pendulum. It swings both ways. Okay. We should be able to give you access to individuals who are willing to work with you, willing to assist you with that data that you need, because that moves this country, that moves this world. Okay. But yet at the same time, you've got to be able to understand that they don't really care about your data or my data or anything else that anybody is asking. What they're trying to do is not just survive, they're trying to thrive through every type of barrier that has been placed in front of them. I can remember someone telling me, well, you know what, we can give them a bus card and they can catch a bus. Well, if you got a mom with a set of twins, she's pregnant and she's dragging a toddler, how are you going to get on a bus with a double stroller and screaming babies? It's just not going to work. She's not coming. So that's the reason we try to place everything in one location for them. And we don't give them restrictions, we don't give them times. I tell people consistently that we are the Ellis Island of the east side of Buffalo, okay?
So we're going to be wrapping things up, but I just have two quick questions. First, what advice would you give librarians who are hoping to like engage in this type of community like engagement work?
To remember that you guys are the information network of the community. Most libraries are within communities where those social determinants are. And if you open your doors and let them know that they're welcome to come in, they'll come.
And to end, what gives you hope in this work? What gives you hope?
What gives me hope are the students that I see coming in public health and the questions that they ask and the willingness to accept change and to give back to the community. That's what gives me hope.
Okay. Well, thank you,
You're welcome.
Reverend Holt. Thank you as always. I appreciate it.
Thank you so much. This was really wonderful. I gave a lot of comments and you'll have questions too. So our final speaker, I'm really looking forward to hearing you, Chloe. So I'll turn it over to you.
Hi, hello. I wanted to start with an apology because I believe there's a slight echo in my room. Hopefully that isn't too much of a barrier for anybody while listening to my presentation. But I am a social worker at the Central Arkansas Library System. That is a library system here in Little Rock, Arkansas. We were actually the first and currently still the only library system in Arkansas to have social workers. I think that's a really cool thing to say, like selfishly, but I would love to see that change. Obviously, Arkansas has a great need for social workers and has a very large population of patrons who come to the library seeking resources. So I just wanted to start this with a quick look at, let's see, I'm in a library, so some of y'all probably know how slow the internet can be if you see my PowerPoint is loading a little slow. So the idea of social workers in a library is called whole person librarianship. That idea is one in which social workers actively engage with and support patrons and staff at the library through providing resource navigation, offering crisis intervention, going to outreaches within the community, and advocating at several different levels for patrons and staff and policy. It also is about fostering a collaborative approach to addressing the community needs and really just connecting patrons with the essential resources that they need on a daily basis. So if you were in any of the presentations earlier, I know there was a set of presentations about social work in the library. You may have heard some of this before. But whole person librarianship started in 2009 in the San Francisco public library system. They created the first full-time social work position. This was a reaction to the 2009 recession. And in 2019, Little Rock, Arkansas was seeing some political and economic crisis that led our director to hire his first full-time social worker. And since then, our department has continued to take social work interns from the local master's college, as well as 2 more full-time employees. So how did I get here? I started, as I said earlier, we took on interns in our department, and I started as one of those MSW interns in August of 2002. That's not right, 2022, excuse me. After the community resource manager we had applied for an Arkansas Department of Health grant, I was able to start in full-time as a working paid intern, and then was able to transition fully into the position after graduating. I received my master's from the University of Arkansas at Little Rock in May of 2023, and then I was able to take and pass my licensing exam in March of 2024. So while we were able to hire on our first social worker and take that in to our budget as a library, it's always been really important to us to find funding resources to help us maintain the social work and grow the social work department. So in December 2021 was when we first started looking into the Arkansas initiative to address COVID-19 health disparities for high risk and underserved grants from the CDC. This was an American Rescue Plan Act, and it was funded to help public spaces help their patrons, patients, students, whomever it may be. We were able to fully obtain that grant in August of 22, and that is when we started working towards having me start full-time. And we also started having my coworker full-time. We initially received $293,000 from the Department of Health, and that was, there we go. So we were able to bring COVID-19 test kits to all of our branches several times through this grant. And we were also able to maintain and fund several programs system-wide related to health disparities and health equity. We were also able to bring a local hospital to our library branches on multiple occasions to provide COVID booster shots, flu shots, health screenings. We were even able to give folks who got those COVID boosters with gift cards. So we had some really great incentive, especially for our unhoused patrons, to actually start seeking out and finding ways to get those booster shots. So in 2024, the CAUS Library and the Community Resource Department began the process of applying for a grant from the Arkansas Opioid Recovery Partnership that we were unfortunately denied for, but I thought it would still be important to bring up just to give the idea of different grant monies that could be searched for and applied to for our type of department. Through this grant, we were really hopeful to hire a few peer support recovery staff members. I don't know if anybody here is aware, I'm sure they are, but those peer workers are folks with lived experience when it comes to areas such as incarceration, addiction, being unsheltered, and they have found stability, found sobriety, found whatever that looks like to them, and they have been able to now help guide other individuals to those stable areas of life. So that's something we're always looking for different funding sources. Again, I think peer support specialists in libraries are a great tool, and it's something we continue to love looking for. So from May 2024 to February 2025, we were offered an extension for our Department of Health grant. We were given an extra $100,000 to do another year of it. And that really looked just like more and more COVID tests for our branches. That was a extremely popular program our library held. We were able to give a COVID test we were able to give 2 boxes holding 2 each to anybody who came and asked. We did not take any information from them, no names. It didn't require a library card. There was no tracking. And we were really able to just get COVID-19 tests in our community in a capacity that was extremely helpful. We wrapped that year up in February of 2025, and we actually were able to have the board fully approve having three full-time social workers at the library. And we are, at the Central Arkansas Library System, we are a library of 14 branches. So I always say we could have more than 14 of us and still probably have a need. But it's been amazing to have a full team of 3 plus a yearly intern from the master's school. And we have recently applied for and continue to apply for Delta Dental grants. Through those grants, we have not only been able to supplement some of the pay of our staff, but we have also been able to host a variety of dental health programming with our unhoused patrons in mind and create dental health kits for our patrons. We have really tried to look at the different needs our patrons have, and one of those particularly is that we have patrons who have very poor dental health or no teeth at all. So when we make those dental kits, we keep that in mind. We've made some that are purely for our patrons with little to no teeth or extremely bad teeth. We make sure there is gum cleanser in there. There is mouthwash. There are things that are not just toothpaste, toothbrushes, and floss. And we've also used it to try to get some nutritious and soft food for those patrons. We keep a lot of snacks in our department to give out. And in a lot of cases, those granola bars, those jerky meat, it's not something that our patrons with dental issues can accessibly have. So we really tried to push that accessibility for those patrons through this grant. We've also been able to host 2 years in a row now a dinner at one of our local day centers that's called Canvas Community. We host the dinner as well as bring out different providers to that dinner. We were able to actually bring Delta Dental and River City Ministries, which is another unsheltered provider here in our town, and they provided dental resources and even talked about their dental clinics for those participants. So these are just more examples of some of the community outreach and programming we do as a department. This picture on the left is my coworker Mikos at a potluck food rescue pantry that we do at our Millie Brooks branch. Potluck Food Rescue is a place here in Little Rock that rescues food from restaurants and grocery stores that are no longer able to sell but are still very, very well consumable. And they distribute that food out to many different places that need, including the library that has, may get this number wrong, but I think we have 4 potluck fridges now where they get to come and fill up our fridges that patrons can come and pick from anytime the library is open. And at our Millie Brooks branch, which is our our food desert branch. That community, that town has no grocery store. Their only grocery store, which was a Dollar General, actually was just closed last year. So that was a big blow to that community. Most of the individuals who live there do not have transportation. It's mostly elderly individuals and individuals with long-standing disabilities. So transportation is a big barrier for them. So we go out weekly with a potluck food distribution and do a what is essentially a free and open market for folks where they can come through and pick multiple items to take home with them. In the middle, I have a photo of that family style dinner at Canvas we talked about. That is our department and some other staff from the library who volunteered to come out and do the feed. That usually brings upwards of 200, 250 folks to it. It's a hectic night, but it's usually one of my favorite nights of the year. I love doing the dinner at Canvas. It's just so refreshing to get into the community and to sit with them and have dinner with them and just build community with my patrons. A lot of them are folks I see every single day at the library, and just to have experiences with them outside of the walls of the library is extremely meaningful for me and for them as well, I think. And on the right, the two of them are two different health fairs we've had at different branches. We are receiving another small portion of money from an art institute called Wingate here in Arkansas, and we are dedicating that money to health literacy. So we are putting that aside to creating different health fairs at our branches every year, in which we can bring local health organizations to the library and make their services and information accessible to all of our patrons. We're hoping to do a third one this year with that money. Let's see. So a lot of our job is the patron one-on-one interactions. Those usually come from our unhoused patrons, but because of the wide variety and change of socioeconomic and political statuses that folks are dealing with nowadays, we are seeing more and more patrons from different lives and different point of views that we've ever seen before. These are folks who have probably never had to seek out a system or seek out a government assistance, and they're now having to do it. And it is, as a lot of us know who have done it either for ourselves or for patrons or patients we work with, it is an overwhelming system. So a lot of our patron one-on-one interactions look like helping our patrons find food resources, helping them find housing resources, whether that is looking for and finding public housing, finding emergency shelter to stay at for the night, finding ways to find income for hotel rooms for short stays. We also help our patrons find clothing and household goods very often. And we do a lot of resource allocation, as I call it. A lot of our job is knowing what is available in the community and being experts on that to then give the knowledge out to our patrons. We know what's there, we know what they do, and we know how to guide our patrons to and even through those resources sometimes. So this is just a quick idea of the patron tracking software we use. So this is a site called Charity Tracker. We, as the social work department at the library, use this to enter information about our patrons. Now, we do not require our patrons to give us any of this information. Most of this is things we have gathered ourselves. We may ask, but we always tell our patrons it's not required. Just the more information we have, the more we are able to keep and then use that in the future with future interactions with those patrons. So this helps us with our grant reporting. Anybody who works with grants knows that they oftentimes require a lot of visible numbers to keep them sustainable. So we want to make sure that we are keeping as much as we can to ensure that the grants are successful. This information is confidential and only accessible to the 3 Cal social workers and the intern we have at the time. None of this information is or can be accessed by other library staff members or even other social service providers in the community. I know it's small probably for you guys, but on this page, this is what it looks like when we add a case. So this is the patron's demographic information and the types of services that we provided to them. And this is an example of what some of that statistics and graphs looks like from Charity Tracker. In a report I ran, we have worked with an estimated 1,144 patrons since January of 2023. And this number doesn't even take into account the amount of patrons we have seen multiple times. This is just the people who have come and seen us at any point. Demographic information is often self-reported by patrons or gained organically through our conversations. So that can lead to some misinformation or some missing information. We try very hard to keep these stats as accurate as we can, but whether we have a quick 5-minute phone call with a patron, we have an email with a patron, we see them at the library for a very short amount of time before they're on to their next need. Sometimes that information can be missed, but we have worked with 1,142 households, and within those households, that's where that 1,144 patrons have come from. So resource navigation is, as I said earlier, probably the largest amount we do. We help our patrons find community resources such as employment, public assistance benefits, SNAP benefits, shelters, vital documents, free meals and clothing in the community, substance abuse treatment, and mental health treatment. We also want to make this information easy to digest for our patrons and easy to share for our patrons and within our libraries. So we work really hard to make infographics and obtainable flyers to share community-wide. These, such as this hygiene resource and free meal resource I have on the screen, we take that to every event we go to and give it to everybody. We share this with community members and with other social service providers, and we share this with all 14 of our branches at the library, just with hopes that this information makes it into the hands of somebody at need. And we really like to talk with and meet with staff and patrons at each of our branches to find their needs and what they are looking for and make very specific information and content for those branches and those patrons. That brings me, some of you, depending on what work you do, may have used findhelp.org at one point in your career. I just always want to bring that up and talk about how helpful of a resource it is. It is a digital tool that social workers, library staff, and any other community workers can use to connect their clients and patrons to social services in the community. When you go to findhelp.org, the first page you will see is this page on the left in which you'll put in your zip code. The site has actually updated since I made this presentation, but it doesn't look too much different. Now it asks you for a zip code and an example of what the resources you're looking for are. So you'll just type that in and it will take you to this next page that just has thousands of resources in which you can scroll through. Those resources can be food, housing, medical, legal, income, jobs. It goes on. And what I love about findhelp.org is you can actually select multiple resources at one go, and you can have it created into a really handy PDF document that can then be printed or emailed or sent out and shared with that patron. And this quick PDF gives all the information the patron would need, including the name of the resource, its locations, its hours, what you need to attain the resource, whether that be it's maybe a food bank that requires you have an ID or you live in a certain zip code, it will have that information. And it is just everything a patron can need to have some more self-determined help. That comes in really handy before I start with the crisis intervention. The findhelp.org can be extremely handy for us because, as I said before, we have 14 branches and only 3 of us. And we do a lot of running around, but we're not always accessible when we're needed. So being able to point a library staff member or a patron themselves to findhelp.org and explain to them how to navigate that website can be extremely helpful to make sure, at least in that moment, our patrons are finding some information about resources, even if we're not available to give that information. Crisis intervention is another part of what we do. Our team is certified in crisis intervention, which is an acute intervention designed to stabilize and mitigate the crisis response. As we know, that the public library is the public, and with that comes critical incidents and crisis. So what we do after a crisis happens, we can come in, and our first step is to work with the staff members and evaluate how the staff were affected by that crisis and helping them find a way to healthily respond to that crisis. We like to say that it's therapy light because it is not considered therapy, but we want to give our staff members the therapeutic tools to find help for themselves. And we like to push them in the direction of what that therapeutic tool may be, whether that is actual therapy, reaching out to our employee assistance programs, reaching out to their personal therapist, and other coping and self-care work that comes with that. We also have done this for patrons in those incidents. Many times the incidents are centered around or surrounded by patrons, and we have had incidents where a patron has come to library staff later and shared that the incident really rocked their sense of security. And so we've come in before and had those same sort of discussions with those patrons, and then also helped them find resources to respond to that incident. So a real life example we had actually quite recently after we became certified in crisis intervention was a tornado that hit Little Rock in March of 2023. We had many staff members and patrons alike whose homes were hit by that and who were affected physically and emotionally by that tornado. We helped both patrons and staff alike with issues such as finding and receiving therapy for emotional distress. We helped with FEMA applications. We helped individuals find resources when it came to obtaining food, clothing, and household items after losing it. And we even, went out and helped with this was more on a personal level for most of us. We didn't do this in work time, but we went out to help clean up the community after it was affected by the tornado. So education and training is another piece of what we do. So we train our staff members here at the library on a variety of needs and issues that our patrons may come up with to help them gain confidence and become more competent in managing those unexpected and unpredictable events and keeping the library safe and comfortable and supportive for not only our patrons, but the staff themselves. We want to make sure that our staff feel comfortable and confident when talking with patrons from a whole wide variety of backgrounds with a whole wide variety of needs. So we are oftentimes reaching out to our staff and asking them what they need, what they feel like they're lacking, what they're not confident in, and trying to find, whether it's ourselves who does the training or if we find somebody outside in other environments to come do those trainings, we try to make sure that everything our staff needs is covered. So some of those trainings in the past have looked like that critical incident training. We've had harm reduction at the library where we've actually had a harm reduction person come out and teach our staff how to administer overdose reversal means and what an overdose looks like and what to do. And they actually left us with a large amount of naloxone afterwards and gave a lot of our staff members just an extra level of confidence when it came to having an overdose and reversing those overdoses when they happen in public, which we know they unfortunately do. We've had security trainings. We are also, I'm not sure in Arkansas how many libraries have safety officers, but we're also a library system that has those. So we are constantly working with our safety department to make sure that they are equipped for dealing with patron situations when it comes to patrons who are in active mental health crisis or active addiction. Mental health first aid is another training we do often, and there's many more that come up randomly. So partnerships and collaborations, one of my, I said at the very beginning of this that we are the only social work department in the library in Arkansas, and I'd love to change that. And one of the ways that I try to change that is by telling everybody I can about what we do, doing presentations like this, going out in the community and talking about social work in the library, going to other Arkansas communities and towns and their libraries to talk about them, and just get the idea and the information about social work in the library and what it looks like out to people is super important to me. We have been on the radio before to do that very thing, just to tell our community members about what we do and what we're here for. We also every year partner with PBS to do the Mr. Rogers Sweater Drive, in which all of our branches collect sweater and other winter weather apparel donations and distribute those to individuals that need within the community. And another conference I went to recently, which maybe some of you on here may have known about or even went to, was the library's Advancing Community Learning to Reduce Substance Abuse Conference. That was in May of last year in Kansas City. And it was the coolest conference full of library staff members who are dedicated and passionate about reducing substance abuse in their communities and their patrons. And I'm hoping to see some really cool stuff come out of that conference. So that is the majority of what I had to talk about. I just wanted to give you guys a super quick overview of social work in the library and what it looks like in our library. So yeah, you'll see my email address here. It's ckilcrease@cals.org. Please reach out to me with any questions you may have or information you may want to have. I'm happy to talk. I'm happy to share information and to give everyone I can the information they need about social work in the library and how they can obtain social workers in their system. Thank you, guys.
Thank you so much. This is amazing how much information on what people are doing this amazing work. It's just like, it's so wonderful. I'm really glad. I remember when I first heard about the social determinants of health and I thought about libraries, and I remember thinking libraries save lives. Like that's when we apply for funding, we should just say we save lives because we address the social determinants of health and we keep people alive. So that's what we should be saying, not this is how many programs I do. We should just be saying we save lives. That's why you wanted to support us. All right, so thank you. There's been some questions posted in the Q&A, and it looks like they're being answered, have been answered by, it's divided into open questions and answered. It looks like you guys have been answering them, but is there anything else you would like to say about the answered ones?
There was one question that I said I would just answer more in the open chat, if that's okay. And Stony already did a great job touching on it. I think it was Noah asked, and excuse me if it wasn't Noah, but I think Noah asked about how our program, Healthy Libraries program, has had sustainability, and asking how it's launched in 2020. Now it's still a thing and it's growing. And so I think there's a couple of reasons why our program has been successful. First off, and tying into like the amazing power of social work, our social work internship program started first, and that's like as Sunny mentioned during our presentation. So we really launched off the success of our social work interns. Leah Topek Walker from our School of Social Welfare, she's involved in healthy libraries and in training the social work interns at our university and supervising them. But she started in I think about 3 or 4 libraries, and now she's in like 35 with social work interns. So that's pretty amazing throughout Suffolk and Nassau County. So we launched off the success of that social work program by then addressing that need of, from what my director of the program found is that there wasn't these health topics that were being addressed, and social work scope of practice and librarian scope of practice that are not that cannot address these like different health questions. And so then we felt that she felt at the time that if we modeled kind of the social work internship with public health and clinical fields, if we paired them together, then that would be, then we could sustain a model like that. So we launched off the success of the social work program. Stony Brook was already, our university was already in libraries through that way. So we kind of already had an in through social work. So that's one reason why we were able to be sustainable. Another reason is, as Sunny mentioned, we had investment from different health science schools at our program. So we have nursing investment, we had PA school, we had medicine students and social work and public health students. All the faculty and staff involved in those schools were interested in becoming involved in our program. So there's like commitment and investment from these schools. And students have to complete different internship and practicum experiences. So we were able to model the program based off these requirements of these different curriculums. So for the public health students, they have practicums they have to complete. Same with the social work students, they have a certain number of hours they have to complete. And additionally, with nursing and PA students, they have, or nursing students have clinical rotations, and then PA students have volunteer hours that they have to fulfill. So we were able to tap into those different curriculum criteria and then engage student professions that way. Additionally, as Chloe mentioned too, we were able to show our impact of our program to keep it sustainable. So first off, we were able to show the community impact. And we didn't really touch on this that much in our slides, but there is a slide in our slide deck showing our different like impact numbers and what we've achieved. So we were able to show how many patrons we were screening for high blood pressure, how many patrons we've been able to connect to care, how many patrons were able to connect with different health related resources and show our impact of our program. So having like a tool and a documentation method has really helped our program be sustainable because we're showing that it's working. And additionally, we're showing that students are learning from each other. That was another big component of our program is student interprofessional education. So they're learning from each other, they're growing from each other, and that's an investment from the university. Oh, students are also benefiting, the community is benefiting from this program, but also our students are, and they're learning. And so that's kind of all the reasons why we were able we're able to make it sustainable. And the goal of our program is to continue to grow it, keep that sustainability. And so yeah, just wanted to kind of touch base on Noah's question from earlier. But those are the big reasons why we've been able to grow and continue.
Hi, and I also had a question about the grants, so I just wanted to answer that live as well. Grants do, in fact, take a lot of work, I think, as most of us who work under a grant know. Our library system actually has 2 staff members who are dedicated to finding and maintaining grants and donor funding. So those 2 staff members, I applaud them daily because the work they do is insane. They are oftentimes seeking out grants, applying for, and then reaching out to the appropriate departments within the library and asking, we're one of those obviously, and they ask us, is this something you think you have the time and capacity for, and how can we do it? So we are usually actively part of the application process. We are helping those two staff members, Eliza and Hannah are their name. We're helping them apply for those grants and answer those questions in those grant applications, as well as facilitating some of the needs of that grant. So the Delta Dental grant, we are facilitating that grant by buying and providing those dental kits for our patrons, and then doing those dinners at Canvas Community and bringing dental awareness and dental health information to those programs. We are usually, a lot of our tracking is solely for those grant purposes. So we track the data and get together monthly or quarterly, whatever that specific grant wants, with our grant staff and put that information together and help them with their write-ups. So it's definitely a big partnership. The Hannah and Eliza do a lot of work to make sure we are succeeding in the grants and doing what they need, and we do a lot of the background work to just make sure we're doing it all and reporting it correctly.
Great, thank you. Any other?
And I'm sorry. I just wanted to mention that I popped in. I know a couple people had asked the Q&A for the article links and just our website, so I posted that in the chat as well.
Great, thank you. I actually have a question for Reverend Diann Holt. I am really interested in the topic of breastfeeding. I ran a business for many years where I had women that had breastfed go in to help people who had just had a baby to support it. And I feel like we went through a time where we were trying to sell the idea of breastfeeding, and it was working. And now I'm seeing I feel like now there's lactation consultants and there's all this stuff, and I feel like I'm seeing less breastfeeding, and I'm seeing it in my own family. I feel like actually the doctors and the hospitals are sabotaging it, and I'm wondering if that's been your experience. And then I see there's a question for Chloe also, but I was just horrified at the advice and the information and the misinformation and the weigh your baby before and after, this whole horrible stuff that's going on. So anyway, I wanted to see if you saw anything like that. So thank you.
Yes, I did. That's one of the reasons I would personally go into the hospitals to make sure that they were at least making it available to the moms once the baby was born, a lactation counselor or a lactation consultant or someone to assist mom with the process. Now, our program, we have a lot of, I guess you could say, individuals who I call our new Americans who know to breastfeed, but they are not encouraged to breastfeed. The bottles, they'll say, well, the blood sugar has dropped on your baby, so you need to give the baby some breast, but the formula. And I also see that sometimes the lactation consultant does not show up until I show up. It's like the movie where you say, she's in the building. And all of a sudden, the lactation consultant comes down to work with mom. And they seem to have very little patience with mom when she's having difficulties getting the baby to latch. So what we do now is that we go in, we sit to the side because that is not our job. Their mom's still in the hospital, and we allow them to do what it is that they do. And once they leave, we don't follow the guidelines that they give us, that you only do 3 visits for this and you only do 2 visits for that. As long as mom is saying that she needs assistance, we're going to go to the home to make sure that that occurs so that that baby can breastfeed. And we have probably the longest duration of breastfeeding than most programs in our city with regard to mom's breastfeeding.
I'm so glad that's happening, because I have just really been concerned. I feel like the medical profession takes something that's natural and turns it into something that's unnatural. And then I don't know. I don't know what it is, but anyway, I'm glad you're having some success.
I normally tell people breastfeeding is natural, but it doesn't come naturally to everyone.
Yeah. Yeah. Um, are there any questions that haven't been answered? Because I thought there was another one, but it looks like I don't know. I'm not seeing any more open ones or any questions people have that you would like to ask, put in the chat, or questions you have for each other. You know, there, here you are. You're all here together. There's some great information here. So if the audience wants to post anything in the chat or the Q&A, or if you want to ask each other questions. Matt, I was going to ask you about the cost, but somebody asked you that already, or you mentioned it, so that it's free. I was really glad to see that. Yeah. Any others? I'm fascinated by the Mr. Rogers sweater drive, I have to say. I've never heard of that.
One of my favorite things I do. That's kind of one of my claims to fame because one year we got almost 2,000 articles of clothing from that sweater drive. And it's a lot of work to coordinate 14 branches donating items and then getting all those donated items to one or two social service providers. So it is a whole month of effort, but it is one of my favorite things. I love to see it. I also just wanted to say that I put in the link for whole person librarianship in the chat. So on that link, you'll find information about the book that they have, the mail list that you can join. There's also a blog and a Google listserv that is for social workers in libraries that you can join and communicate with all of the social workers in libraries across the country and ask questions and find support and get information from.
Great. Yeah, I'm familiar with their website. It's wonderful. Yes, it is. It's a warm and welcoming bunch. So any of you, we have a few more minutes. So if you want to make like a last, something you didn't get to say or something you wish you had said or something you wanted to comment or whatever about this experience, please feel free.
I would like to say, I really believe that there should be a little more push toward introducing to every community the fact that the library is a resource that is underused, that the librarians are someone who I go in it, well, my best friends are librarians. But I actually sit down and talk with them and I pick their brains because they're a wealth of information. If I have a research project or something that I need information on, I don't have to do that. I can pick up the phone and call Ophelia and say, could you look this information up for me? Can you give me a summary of what I'm looking for so that I can break it down in layman's terms for our mothers? And we have a program where, well, basically it's a gift card that we give moms, and it's a tool of, I hate that word teaching, a tool of sharing information with them where I'll say, Black history is 24/7, 365. So here's some information on maternal health. Who was known as the father of gynecology? Blah, 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 blah. So we'll get a chance to educate them. In our city, we have a doctor by the name of Dr. Jalisa Sosa, who basically came up with a technique for less invasive removal of what was it? Not tumors, yeah,
Fibroids,
fibroids. So we'll say in this city at one of our local hospitals, who is the doctor that came up with that? So we're basically giving them the information that they need in a way where if they get the answer correct, or even they don't get the answer correct, we would give them a gift card for at least attempting to figure out who that individual is.
That sounds great. Yeah, thank you. Any other final comments or thoughts you'd like to
It
share?
was wonderful getting to hear about all the amazing work you're all doing. And yeah, I'm definitely will continue to follow up with all the amazing work that you all are doing for your communities. And thank you so much for, letting Sunny and I share a little bit about our program. And this is a great experience.
Great, thank you.
Thank you.
Any other comments? You're getting some nice comments in the chat. Yeah, inspiring. It is very inspiring.
And
Right.
I believe the slides and resources will be shared after this with participants. So I just want to just let other participants
Yeah.
know. Yeah. So any like websites or things like that, so we can all continue to follow the work of everyone that was here today. So
We're
Yeah.
in the process of, I guess you could say, recreating a new web page. It won't be this exact same web page that you currently will find up currently. We have somebody working on it so that we'll have a web page that pops.
okay, great.
Yeah, I've found in my work that one of the biggest barriers for potential partners or people reaching out to libraries is just their lack of understanding of what libraries can do. You say library, they say, "Oh, it's somebody going shh," and there's like they have no idea the social justice work that we do. They don't. Yeah, it's a huge barrier, and we're not very good at marketing ourselves. That's what I think. We need to do a better job.
That's true.
Let's see, there's a comment in the, let's see. If anyone has funding resources, please let me know. This is from Carrie. And somebody else is talking about what a strong opportunity. Yeah, how to partner with us. Yes, no. All right, and I have a little thing I have to read at the end. So thank you, everybody. Thank you for the audience for attending, which, yes, definitely. And then we are committed to ensuring that CERT's programs are diverse, inclusive, and free for attendees. And that's something that is just so important to CERT and to the programming committee that it's free and you don't have to belong to ALA. You don't have to, there's nothing you have to do. You just register and you get to attend. And I just think what a gift that is. And I'm really, really excited to be part of that. You can help champion our roundtable's mission and commitment by donating at the link provided. I don't know. Yeah. Okay, there's Rachel's putting that in now. Or by joining CERT as a member. You have to be a member of ALA apparently to join CERT, but I think you can still donate money. I think that's right. Please help us maintain our high quality programming, the core values that sustain it, and our commitment to accessibility by making a donation, becoming a member, or just helping to spread the word about our programs, our roundtable, and our events. And then the next session is Centering Lived Experience through Partnership, Storytelling, and Innovative Programming, and it starts at 5 p.m. Central Time. And so thank you, everyone, very much. And she put that in the chat, too.
Yes, and
Great to
we'll also
Thank you.
discuss Black
Thank you.
maternal health in that one too.
Yeah, such
be
an
great.
important topic.
Yes.
All right, thank you. And
Thank you.
Thank
everyone.
you. Bye. Thank you so much.
somebody's going to end it. How does that?